are signs a second wave of COVID-19 is beginning to hit long-term care homes in parts of this country. Despite the promises to protect the most vulnerable and improve conditions and staffing levels in care homes, it seems not enough has been done. As of yesterday in Quebec, there were active cases in 79 private seniors' homes and long-term care facilities. Ontario is now reporting active outbreaks in 57 facilities. And Ontario's patient ombudsman is warning more must be done to avoid another long-term care catastrophe. In a new report that documents hundreds of complaints, the ombudsman says patients and their families were essentially set adrift when the pandemic hit in the spring. As Ross Lord reports, there are fears some facilities are headed down that same disastrous path now.
With dozens of long-term care homes in Ontario reporting COVID-19 outbreaks in recent weeks, many in the healthcare system suggest conditions are about the same as they were in the spring.
My fears are that, we haven't learned any lessons and we're going to see another wildfire spread of the pandemic, that residents and workers are going to lose their lives at a greater rate than what we saw in the first pandemic.
The province's Long-Term Care Association says some new measures are in place to control the virus, like more cleaning.
We've reduced staff to only working in one healthcare site, and we've reduced occupancy admissions into these 3 and 4 bedrooms and readmissions into those rooms. So starting to certainly ensure that there are no more than 2 people in a room.
Duncan says staff and residents still need faster test results and better personal protective equipment. In a new report, Ontario's patient ombudsman recommends visits by a limited number of essential caregivers, dedicated resources for communication among patients or residents, families, and staff, enhanced whistleblower protection, and contingency plans for all healthcare providers, including a staffing plan for COVID-19 outbreaks. But Plan A is getting more staff to replace frontline workers who left their jobs.
We believe that we still have thousands of people at home.
Fears of a devastating second wave are spreading across Canada, even inside the so-called Atlantic bubble. New Brunswick had very few COVID-19 cases until an outbreak this week at a long-term care home in Moncton. Anne-Marie Johnson is afraid her mother, Huguette, will contract the virus.
I don't want to lose her. That my whole family doesn't want to lose her. We lost our dad going on 2 years in January, and she's the heart of our family.
Back in Ontario, there are doubts a temporary pay raise of $3 an hour for personal support workers will make any difference. Their union says only offering more full-time jobs with benefits will bring workers back and attract others, so homes have better odds of suppressing the virus. Ross Lord, Global News, Halifax.
Canada's Privacy Commissioner says the pandemic has accelerated the need for better laws on privacy and data use in this country. Daniel Tyrion tabled his annual report in Parliament today. He says most interactions online, from working remotely to socializing, logging into school, or discussing health issues with a doctor, use commercial video conferencing technology. And he says there's a risk third parties could capture sensitive information.
I'm frustrated for Canadian citizens. Firstly, so Canadian citizens have less privacy protection than citizens of about 40 countries that there's no reason why